Hello, Dr. Lexima.
Hello, Dr. Garais. How are you?
Good, good.
Please have a seat.
Oh,
Good to
thanks.
see you today.
That's
What brought
good.
you here today?
It goes well. It goes, we have some guests today here on Facebook Live.
Okay.
Good morning, everyone.
Good morning, everybody. So that's great.
Yeah, my name is Dr. Nelson Garais, and I am with Health Sciences here at the Alexandria campus. And this lovely
I'm
lady.
Dr. Lexima, and I am the nursing director at Alexandria campus.
And because we want to welcome all of you at your homes into our home and talk a little bit about this lovely campus that we have here in lovely Alexandria. And it's on a 5-floor, 60,000 foot square campus. And the School of Nursing and the School of Health Science occupy the 4th floor. Now, the School of Health Science encompasses several schools. And while Dr. Lexima heads up the School of Nursing, School of Health Science encompasses health science, health information management, medical assisting, medical billing and coding, and healthcare administration. And now I'm going to give the floor now to Dr. Lexima to talk a little bit about nursing.
Absolutely. The School of Nursing, we have 3 campuses, Fort Church campus and Woodbridge campus and Alexandria campus. And this is the campus where we are here today. We have one nursing program. However, we have different tracks. We have the BSN, RN to BSN track. We have the LPN to BSN track. We also have the second degree students track that can be like anybody with a second degree want to have a much a short course to nursing as well. At Alexandria, so we are basically make it convenient for our students, and we an evening and weekend programs at the moment.
It's great. And also, some of you may have seen some of our commercials and some of our YouTube, and what makes us a little bit different, health science and nursing, than your other schools in the area and even in the country is, first of all, it goes, as you can see here, because we're not a big university, we're small. And we have a very good teacher to student ratio. And Dr. Lexima and I know our students by name, by face.
Absolutely. And this is the great thing about Stratford University. We are a community school. We know it, everybody knows each other, all the faculty, and then all the students know each other, and we also know our students.
And I challenge any other, the larger universities in the area and anywhere else, can they actually say the same thing? And another thing, since we're small, we're also very good at evaluating transfer credits, and we're very fair about it. Wouldn't you say that?
Absolutely. Yes, we are basically beyond fair because we give the students credit where they deserve. And rather than taking the class over again, we look and see how we can, where the students deserve credits. And then we balance. We have somebody who specializes in evaluating all the transcripts. And then we look and see where they deserve credits and they get it.
That's great. Because, and lastly, because another thing about having a smaller classroom and that one-on-one personal education care is a greater emphasis on hands-on training. If you take a look at our catalog, all the courses are geared for a specific career track. I mean, Dr. Lexima, we don't have any, I loved my literature class in college, but as a physician and as a nurse, I don't think literature it was nice, but because isn't directly usable in the real world. If you look at all of our courses, especially our arts and science courses, also known as general education, they're important for communication and important for a lot of things. And we're very, very big on hands-on. And with that being said, I think Dr. Alexa and I should show you our labs to see exactly what we mean.
Absolutely. We can take a walk right now to our labs. So this is where really actions happen before we send our students to the hospital. And they really enjoy it. We enjoy the lab as well.
Yeah, that's
and
part,
I know
that's part
for myself, when I remember being in nursing school, that was my favorite part.
Get to do all the fun stuff. So let's
Yes,
go to
so
let's go to
take
the
a
fun
walk.
stuff.
Absolutely.
Thank you, doctor. I'll follow you.
Sure. Hello, Professor Beninger. How are you?
I'm fine, thank you.
Okay, this is Dr. Garais. You say hi.
Hi, Dr. Garais, how are you?
I'm good.
Oh, that's good to hear.
I'll see you, Professor.
Okay.
Professor Greninger is one of our many nurse professors here.
We have a very special space here at Alexandria campus, very large hallway. Our students, because of COVID, usually we see students hang out over here, studying or having their break or socializing. So because of the pandemic, we are unable to do that. But we're gonna walk and go to our lab.
And doctor, many students are wondering about what's this hybrid thing that they keep on hearing about.
The hybrid is not because of the pandemic. We turned to be hybrid. Before we used to be on ground. And we are doing that. So we're making sure that the students have some kind of face-to-face with the instructor. We use Zoom as a modality, not for as online courses. And the students come on ground to be face-to-face with their instructors 2 to 3 times during the term. And they enjoy it.
And how long is the term?
The term is only 10 weeks. And you see, so coming to nursing, you gotta make sure you
Pretty
get
good.
ready to roll
Nice.
because we're not playing. Every 10 weeks, we roll.
Oh, every 10 weeks?
Every 10
You
weeks.
hear that, everyone? And it's a good thing because just like real work, there's no break. And also, because if you have more terms per year, then you get to go to work and get to go start making some money and going on your career a lot faster.
Right, and they do get a little break. They get a break during the holiday,
Mhm.
and then we tell them that. So basically, the way we communicate with students when they first get admitted, we have an initial advising. That initial advising really very important to us and
Mhm.
also very important to the student because that really link the teacher and make the connection between the faculty and the student. Our advisors are faculty members who basically teaching, so they will get to know the students.
Oh, that's
So
great.
that's a given. I wish I had that when I was
Yeah,
in
but
college.
do you remember your advisor? I
Oh
don't,
my God, I don't remember
I don't
anything about
even-
my advisor.
I don't
at
even
all.
think I had an advisor.
Yes. Well, while you're there, if you want to be taking a look at our classroom.
Okay. Now, we have, here we are, because we have 4 OSHA-rated laboratories here on the 4th floor at the Alexandria campus. And this is Health Lab 1. And as you can see here, it's geared towards some laboratory science. As you can see, there's microscopes and there are things for, you have an autoclave. You also have, we have here incubators for your science courses for microbiology. And if you notice in the back part of the room, and there's several stations. Okay. And you can see we also do some, since we have a medical assistant, and nursing also utilizes this room as well. And everything that you would have in your lab and in the real world, it would be here. So we do a little bit of pediatrics, and also there's some laboratory medicine here, as you could see here, with our cholestech, LDX, cholesterol, and we also have various glucometers, and this machine right here, we also do urinalysis as well. And these buckets here, you'll see, looks like we're painting, but again, this is an anatomy and physiology lab. We have also sciences as well. And to keep some of the stuff here, of course, this is not where we keep our sandwiches. This is a biohazard. You could see our lovely friend Nathaniel. Oh, Dr. Lexima is pointing to me.
I noticed that you have a full cabinet of supplies right there. It seems like you have lancets, you have all those urine cups there that we use. I see all the lab. Oh my God.
It's everything to
That's
do
good.
phlebotomy, urinalysis, and all the basic things. And that's typically our medical assisting program. But also, like I said, the nurses also use this particular lab, and you could see here why. We have an EKG station here. We have 2 EKGs. We also have a phlebotomy simulation arms. And also here, you have your blood pressure cuffs and an array of course, models and things that we can do. But every classroom here, every laboratory, if you look up all the way up there in the ceiling, that is a projector, and the projector is connected to the computer. And actually, in one of our laboratories, we actually have a smart board, and we could show you that later. Now we're gonna now Dr. Lexima is gonna now show her nursing, so the nursing laboratories,
Absolutely.
which is a little bit, well, not a little bit, a lot more advanced than what we saw here. Here's where you have basic things for a medical assistant. But again, nursing is of course, bachelor's level and takes it to the next level. What we're passing here is a typical classroom. It's a much larger.
Absolutely. We have our nursing cleaning over there. So this is basically on the hallway. This is the student consoles. They put the board together. All right. So here's our one of our classroom before we get to the lab. If you can please open up. Thank you. We keep our labs basically locked.
This has all these fun things in it.
All right, this is our lab. And this is where actions are taking place before we send our students to the hospital for their to be on one-on-one with patient and with an instructor, under the instructor, of course. And then we also have the students, if they are having any difficulty with any skills, so the students can get a prescription to come to the lab, the open lab, and get their skills up to date. All right, so our mannequins are really, we have high fidelity mannequins, we have a couple of them, and we have medium fidelity mannequins. So that means that there are a lot we can do with those mannequins. We do have also an EKG station, we have medication cabinet right there, medication cart right there. We have our mannequins. This one is Juno. Juno is actually a mid-fidelity mannequin, and we can do everything. We can have the students put a urinary tract catheter in there. We can have the students have practice with the trach. We can have practice with IV. We can have practice with even their vitals. Everything can be recorded. We have the simulation pad right there. So when we do case study simulation, the students can be in group or alone practicing with an instructor. So this is great. We have more. We have an IV arm, so where they can practice with the patient under blood transfusion. So I'm not sure who took away my, it's probably over there, my IV pole. So I will put that for tomorrow. And we do have different mannequins. So basically everything the student need to learn for nursing while in the hospital. So you can see you have those drapes for patient privacy and the bedside tables for the patients. We do have the babies. So with the bassinets as well, so the students can start practicing. We have the baby scale. We do have a much older child. So this one is a 7, 8, or 9-year-old. So this is a nice, we love him. So we take good care of him, and the students learn to practice as well. He's a medium fidelity mannequin where we can do almost everything we're doing with the older ones. So we have some beds there where the students continue to practice to move patients. And our Juno over here can sit up, so, and also can talk, okay?
Oh, talk. Ooh.
Yes, absolutely. And then we have Anne. Anne is lovely. So we can turn Anne into male or female, same thing we can do with Juno. And then Anne also come with the SIM pad, and then everything can be recorded in the computer. We can change whatever case studies we are doing, we can change and making sure that the students learn like they were really in the hospital. And they enjoy it. So
Great.
they have a chance to ask the right questions. They have a chance to basically learn and apply at the same time. So without being nervous, like if they were in the hospital. So we get them ready over here, and then they start going to the hospital and do what they need to do. Okay, so we have the station for hand washing station. We also have the eye station in case anything splash. So we teach the students the right way. So you can notice we have a very large table right there in the middle of the room. So this is a way that after we finish, and then we continue to talk with the students, and then get feedback from them. If we have simulation, we do quick conference here. And also we do after they get their simulation, so we can do all the reports, everything there, and see what they learn, and then talk to them about it. And this is our lab. So we also have we can also connect on the internet. We can connect and do anything in here as well. Oh, I forgot to talk about this. The pumps. We do have all the pumps in there, like the ones that they have at the hospital. I think that's the latest model. We do have that also. We have the feeding pump. You know, the students get to learn this real practice like they were on a patient. So they enjoy it, and we enjoy teaching them as well. So that's all for the lab. You have any questions, Dr. Garais? You
No,
want to
because
know?
I really want this lab.
Yes, this is a very
I like
nice
my lab,
very
but
neat.
this
We
lab is
really
very
take good
nice.
care of it. We really take good care of it. I like to go next door with you and show you a classroom, a bigger classroom. So for them to see. Come in. Well, it's good. We have all the cabinets for the students to start their things. When they come in, we have a big screen there. We also have the projector, so we can project on the wall, or we can use the TV. We love those little portable boards right there, because if you're doing math with the students, we can scribble right there and everything. We can have the students practice in the classroom as well, because we do a lot of tutoring for our students, those who are having a little problem with math. So we know that some of our students, they took math for a long time. So we do spend a lot of time working with them in lab. They have also resources such as tutor.com, and we have live tutoring with a faculty or the advisors, so they can get help. So this is a very nice, large classroom. I really love this classroom. And when the students, when they come in, they also enjoy. You can see we have some exam tables back there. Those exam tables for a physical assessment class. The students get to practice on each other while they're in the classroom with their instructor. So that kind of help them, get them prepared as well for clinical. So this is from head to toe assessment class. So anything else you would like the students for me to be talking about here? Because I'm very excited about talking about nursing, because I've been a nurse in the field for over 30 years, and this is my passion. Talking to students, mentoring students, and really be there for them and make their dream come true. One of the good things about Stratford University is that not only we're small communities, so I'll say family in the classroom, you get to know the students. So the students are open, my door's always open. They're there to come and we talk to them. They can talk to me about anything, because if I need to help them, so they know they can be open. And we get that. We develop relationship with the students in terms of helping them move forward with their academic plan. Just build up an individualized academic plan with them, so they know what to expect from beginning to the end. So this is also a nice thing that we don't find everywhere as well when it comes to that. So we also try to make it as convenient for our students. We have students who are adult learners already, or second degree students. They have family, they have life, they're working. They have children, so we have to find a way to help them. So we make it true for them. So while some of them may believe that it's impossible, there's no way they can become a nurse, we show them, yes, you can become a nurse. So we are there for you, really. So for anyone who want to contact us, so we are there for you. So please feel free to contact me or contact the admission team or contact the school itself. So basically, definitely we can help. uh, we can help make it happen. So, Modam's.
Oh, look, Dr.
changing
Lexima,
lives.
there's some, and so at this point, whatever chat questions or whatever, I'll, Dr. Tompa, or myself, we could see it. And then, oh, Dr. Lexima, someone's asking a question, and we could
Okay,
we
so
could
at that point,
interact live.
you can just, I
And
will
then-
take the questions and answer, right?
Yeah, and then you could have a seat, and then I
Okay.
could just, and then we could
Okay.
go from there. But,
Okay.
and
This
that's
is a
the,
Nice view right there, so.
that's the dry run through, everybody,
Okay.
and.
Bye, everybody. Let us know how we did.
And then any suggestions, comments, and recipes, and we'll talk to you soon.